Hello everyone. This class we will learn upper gastrointestinal hemorrhage together. Sometimes we call it UGH for short. The first part is about definition and causes of upper gastrointestinal hemorrhage. Let's see the definition first. At the beginning, we need to know what is upper gastrointestine, and the traditional concept is based on the cheese ligament, which divided digestive tract into upper digestive tract and lower digestive tract. But the cheese ligament is an extraluminal marker that is difficult to distinguish under digestive endoscopy. With the development of endoscopy and imaging technology, in recent years, the duodenal papilla and the ileocecal valve have been used as markers to divide the digestive tract into three parts. The first part is upper gastrointestinal. It's from mouth to duodenal papilla. And then the mid gastrointestinal is from duodenal papilla to ileocecal valve. The farthest part is lower gastrointestinal. It's from ileocecal valve to the anus. At the same time, there are two concepts I want to introduce to you. The first is acute massive hemorrhage. It refers to a large amount of bleeding in the digestive tract in a short time. Upper gastrointestinal hemorrhage often manifests as acute massive hemorrhage, which is a common clinical emergency. Especially in elder patients and patients with severe concomitant disease and recurrent bleeding, the mortality rate is as high as 25 to 30%, which should be given high priority. The second concept is acute gastrointestinal hemorrhage. If the amount of bleeding is small, the abdominal color of the stool cannot be observed by the naked eye. Only the facial occult blood test is positive and/or iron deficiency anemia is present, which becomes acute gastrointestinal hemorrhage. Then let's see the etiology of upper gastrointestinal hemorrhage. There is a very important knowledge that the most common four causes of UGH. They are peptic ulcer, esophageal gastric varices rupture, acute erosive hemorrhagic gastritis, and upper gastrointestinal tumor. Okay, let's see the two photos. We can see the photo on the left is a peptic ulcer. On the right is that is bleeding. This picture was taken in the lower middle of esophagus. We see a few blue varicose veins. Once they rupture and bleed, the amount of bleeding is usually large. The patient may have shock in a short period of time. The situation is usually very dangerous, so we are very careful when doing endoscopy for patients with esophageal and gastric varices. Acute erosive hemorrhagic gastritis is another common cause of UGH. It can be caused by drugs, alcohol, stress, etc. It usually manifests as diffuse mucosal inflammation. This is gastric cancer. We can see the ulceration and bleeding of the tumor site. In addition to the above four common causes, there are also many other diseases that can cause UGH. Let's take a look. Of course, the first kind is upper gastrointestinal disease. It includes esophageal disease such as esophagitis, Mallory syndrome, esophageal ulcer, esophageal injury, and so on. And gastroduodenal disease, it includes peptic ulcer, upper gastrointestinal cancer, we have mentioned before, and acute gastritis, dual volations, which is rupture of the submucosal arterioles, anastomotic ulcer, gastric stromal tumor, and gastric polyps. The second kind is partial hypertensive bleeding. More than 90% of the possibility is gastroesophageal varices. The possibility of hypertensive partial gastropathy is less than 5%. and isolated gastric varices is rare. The third kind is upper gastrointestinal tract adjacent to organ or tissue disease, such as biliary hemorrhage, which can be caused by gallbladder stones, post-operative biliary injury, cholangiocarcinoma, liver cancer, biliary ascariasis, hepatic hemangioma breaks into the biliary tract. Pancreatic disease, for example, acute pancreatitis, complicated with abscess ulceration, pancreatic cancer involving the duodenum, aortic aneurysm broken into the gastrointestinal tract, and mediastinal tumor are also of this type. The fourth kind is systemic disease. It includes vascular disease such as allergic purpura, hereditary hemorrhagic telangiectasia, blood disease such as hemophilia, leukemia, thrombocytopenic purpura, and DIC. Connective tissue disease, for example, SLE, nodular polyarteritis. Acute infection also can induce UGH. For example, epidemic hemorrhagic fever, dengue fever, leptospirosis. Stress can cause gastrointestinal bleeding through damage to the gastric mucosa. So that's what we need to know about the definition and etiology of upper gastrointestinal hemorrhage. Thank you for listening.